Measles is a viral disease. It's a disease caused by a virus that is very contagious, that easily spreads and mainly affects children that have not been vaccinated. If countries, communities are able to achieve high vaccination coverage, measles can be brought under control. It is true that Zimbabwe has communities that are reluctant to receive vaccination, to present their children for vaccination. But because these numbers were very low, and the larger proportion of children were being vaccinated, and Zimbabwe was periodically implementing high-quality measles campaigns, this kept measles out of the country for 12 years. We now have higher numbers of unvaccinated children that can propagate this illness.
You also talked about communities that refuse to vaccinate their children. Can you explain to us some of the reasons why?
So we have some communities that for religious reasons are reluctant to have their children vaccinated. Having said that, in the past, there have been successful efforts to reach out to these communities, to allay their concerns and to get their involvement and engagement and participation in immunization activities. That regular dialogue and interaction and engagement suffered during the COVID-19 pandemic. Of course, with the advent of COVID-19 disease, new vaccines, the COVID-19 vaccines, again, some of the communities, some of the population have unanswered questions. And we, as partners, are working with the authorities in Zimbabwe to reach out to these communities and re-establish that dialogue.
So what does the situation look like in terms of numbers, in case fatalities and infections rate?
I'm very happy that the government of Zimbabwe is doing everything to strengthen surveillance. Right now, as we speak, we see that about 10% of the children that have been reported to have measles have died. So that's a fairly high case fatality rate. But we are trying to validate this by doing, comprehensive outbreak investigation to ensure that all the numbers that we are counting are correct. And one of the thrusts of the Zimbabwe outbreak response is to do everything possible to reduce the high fatality rate as together with the rollout of vaccination.
What else is needed, whether it's community themselves or our partners?
Government, together with the health partners, all the partners, including UNICEF, WHO, MSF, Gavi, the donor community, putting together the resources that are required to ensure high quality vaccination campaign. That is ensuring availability of adequate doses of vaccine, the injections and associated supplies, ensuring strong community engagement across the country, strengthening capacities at subnational, at provincial, district, and health facility level to have high quality planning, training and retraining of the health workers, ensuring that teams have the logistics to go out to reach the communities wherever they are and offer the service, and ensure that the community themselves come out and are comfortable to receive the service.